Hello. Hi. Thanks for being here. My name is Problems-Canares. I'm an assistant professor in pediatric emergency medicine at Johns Hopkins. This presentation is called Smartphones and Smarter Clinicians, a study of smartphone otoscopes and ophthalmoscopes. I have no financial disclosures or conflicts of interest. I do want to point out that we'll be discussing a couple of commercial products. I will be presenting them with no personal bias. I also do have some photos and videos that are included in this presentation that have been, I've received verbal permission from the individuals to use them for this presentation. Do you ever have moments when you're looking here or here and it feels more like this? I know I do. Especially using the ophthalmoscope, I've gotten discouraged over time because I just can't get a great view of the fundus. I think other people feel this way, so much so that there are publications out there describing ophthalmoscopy as a dying art. Well, I'd like to introduce you to several smartphone-based products that I've been using in my clinical practice and that there's some evidence for. We'll be talking about digital otoscopes and digital ophthalmoscopes. One of the digital otoscopes available on the market is called CellScope Auto. This includes a small attachable device that clicks onto a cell phone bumper, and it allows you to view magnified images of the tympanic membrane. You can take photos, videos, you can replay it, download them, send them, text your friends. And in case you're wondering, this product retails for about $2.99. There are several other digital otoscopes on the market. However, this is the only one that attaches directly onto the cell phone camera. There's also digital ophthalmoscopes available. This particular one is called DI. Similarly, it takes a small device that attaches using the cell phone bumper, and it attaches directly onto the smartphone camera. Similarly, there are a couple of other digital ophthalmoscopes available on the market, but this is the only one that connects directly to a smartphone. And in case you're wondering, this one retails for about $400. The ease of use of these products is quite high. With minimal instruction, someone can go ahead and take a video, and within seconds you can see the tympanic membrane with pretty good clarity. I'll demonstrate use of the DI. And here you can also see someone with maybe less than a minute of instruction able to view the fundus. You'll also note that using this product, it was in a lit room with pupils that were not dilated. Next, we'll talk through several potential benefits of these products. One benefit is when you can view a photo or take a video of the tympanic membrane, it can improve your clinical diagnostic skills. For the occasions when you get a very quick glimpse and you're not sure what you saw, you can go ahead and replay that video back for yourself and maybe have increased confidence in your diagnosis. I'll play that video again for you. It can also help improve your conversation with parents and families when you're describing the ear findings that you're seeing. And perhaps that'll help you explain why antibiotics are or are not indicated in a given patient. Now, have any of you ever seen bullous laryngitis? Well, if you haven't, now you have. One of the other potential benefits is being able to replay images of a unique exam finding and use it to teach others, especially trainees who it's difficult to understand, did they see what you were seeing? When you can replay that video and say, this is what's abnormal about this particular exam, it really solidifies learning for your trainees. The other benefit is if the patient isn't there, if you've got this library of videos, you can teach from it without the patient even being present. Or if the patient is present, but you don't want to subject the child to repeated exams, you can use this. Another potential benefit for digital otoscopes is teaching pneumatoscopy. So if you watch closely, you can see a puff and a little shimmer of the light reflex. I'll show you a video of the digital ophthalmoscope as well. And with this, in a dark room, even with a patient who does not have dilated pupils, you can often see a full view of the fundus and the optic disc. So just to review some of the potential benefits, the ease of use of these products is quite high. It can improve your clinical diagnostic skills. Digital products can help with your teaching for trainees and give you confidence in your exam. So it looks like there's a lot of potential benefits, but let's talk through what the evidence has to say. Much of the evidence on digital otoscopes is on the product CellScope, so that's what we'll review here. And one study showed high inter-rater reliability on diagnosis of pediatric tympanic membrane abnormalities between residents and attendings in the pediatric ED. Another study of children ages 1 to 5 showed no improvement in resident diagnostic accuracy using traditional versus CellScope, but it did eliminate repeat attending exams in 54% of patients. And in surveys of physicians in the emergency department, neurology, neuro-otology clinics, they found high efficacy, usefulness, and high use as a teaching tool. So to sum up, this certainly does not worsen one's diagnostic accuracy. It seems to have good inter-rater reliability between a trainee and an attending, and most who have used it have viewed it as very useful and useful especially as a teaching tool. Let's review the evidence behind DI, the digital ophthalmoscope. In one study with children ages 3 to 18 with a dilated exam, they found high sensitivity, specificity, and high inter-rater agreement between pediatric residents and ophthalmologists. In a study of adults with dilated pupils, now these must be ophthalmologists because I don't think I could find the fundus this quickly, but they were able to identify the fundus in 74 seconds with DI versus 130 seconds using the traditional ophthalmoscope. And unsurprisingly, the majority of medical students prefer using DI to a direct ophthalmoscope. Here at Johns Hopkins, we are doing a study on both of these products on our patients in the pediatric emergency department and in a primary care clinic. Our aims are to review how digital otoscopes and ophthalmoscopes improve the tympanic membrane diagnoses, how they improve the view of the optic disc. We'll be reviewing whether there's a change in management, such as a change in prescribing of antibiotics for acute otitis media, or a change in imaging or consultation for your eye exam. We'll also review whether using these products decreases repeat exams by the attending. Of course, with any new product, we want to consider safety. The physical risks to the child are really quite low because these aren't too different from what we use already for traditional otoscopes and ophthalmoscopes. But in the digital realm, one of the things we consider is privacy. So for CellScope Auto, this has HIPAA compliance and uses SSL encryption to encrypt the session and private health information. It is considered a Class 1 device and therefore exempt from FDA approval or clearance due to its low risk. DI is also HIPAA compliant and has FDA clearance for good manufacturing practices. I'd like to acknowledge my co-investigators for the study that we're conducting at Johns Hopkins and acknowledge our funding source, which is the Johns Hopkins Innovation Grant. Thank you so much for your time. Oh, yes. That is a great question. So the question is, are there any software or software tools that help with diagnosis? So as far as I know, there are not there are not commercially available programs that will help tell you the diagnosis. Cellscope Oto in particular, they have a service where you can send your images. If you're a parent, for example, you take a video of your child's ear exam, you can send it to their service, and they have on-call physicians who will review it and give you an answer of whether or not this is an ear infection, I believe within 2 hours. And I believe that's a subscription model, so I think as a parent you might subscribe to that. I don't know off the top of my head how much it costs, I'm sorry. Although I will say, I believe there's a study on that reviewing how do parents do at taking video of their own child's tympanic membranes, and the study generally found it was quite difficult. The interpreter, like the physician on the other end receiving the videos, had a harder time making a diagnosis on a video taken by a parent versus a video taken by a physician, which is unsurprising. I mean, there's some skill involved with using an otoscope. I will point out as well, you asked about, is there software that helps you with the diagnosis? There is an ENT physician, Dr. James Clark at Johns Hopkins, who is working on a machine learning algorithm to help diagnose otitis media with images alone. So the hope is, in time, this software can look at an image and give a diagnosis. Thank you. All right. Thanks so much.